to the Disc and Nerve Recovery Fundamentals community. I'm Jeff Powell. I'm your host here. I'm the group founder. And this community is here. My goal is to provide you all, this community has actually evolved over time. And it became very obvious that most of the people here, almost all the people here, are dealing with some type of disc or nerve related issue. And so I wanted to speak directly to that. So we actually just had an evolution at the beginning of this year, and we switched over, and now we're this disc and nerve recovery fundamental group. And so my goal by shifting the identity of this community to be more specific towards your needs is to, as we go forward, I want to deliver for you information that you don't really tend to get to hear. Okay, it's information that the system that I practice is called integrated functional performance. And so integrated, the body, our bodies work in an integrated fashion. Yes, there's these different systems, there's these different structures, but they're not car parts. They're living tissues, they're living structures, and how they live is based on how the other systems are working together with them. And so an integrated approach is just a more realistic approach when we're looking at something in terms of how it crumbles and how we can actually help it to rebuild. And so today, what we're actually going over is the life of a disc. Okay, so the life of a disc. And so how, or I think I titled it The Living Disc, right? So how do the discs of your body, how do they live? How do they suffer? And then how do they heal? And so, hey, if you're dealing with a disc issue, or somebody you care about is dealing with a disc issue, don't go away. You're going to want to be here. And I would actually say you might want to get a piece of paper or a pad of paper and a pen. If you know this information is valuable to you, we're going to cover a lot of ground. I'm going to get moving really quick. And while you're getting that, I'm going to go ahead and just say that if you're here with us live, go ahead and comment live. If you're catching the recording down the road, go ahead and comment replay. Something I reiterate over and over. If you've been here a while, you've heard this, okay? But stick around, because the stuff we're covering is going to be great. Participation matters, okay? Getting some participation going in these trainings is actually a way for you to start to gain some momentum, to start to gain some forward movement in your own process of recovery. And so that's part of the reason for these trainings as well, is that it gives you a forum to start to participate. So again, if you're with me, comment live. If you're catching the recording down the road, comment replay. All right, and let's begin to get you some momentum. All right, so I want to go ahead and jump right in. I do have one more thing to say. So here in the community, we have these trainings, and so these trainings are meant to provide you with value. Okay, if you're not getting the value you're looking for, then it's up to you to either message me or make a comment. Hey, I was looking for X, Y, or Z. Okay, and then I might actually have it in the community already. We've been here like 3 years, so there's a ton of resources here. So if what you're looking for is not exactly what we're covering today, just comment support. Okay, or if you feel stuck, if you feel like I'm hurting, I don't know what to do, I don't know which way to turn, comment support. That word support here is a trigger for me to reach out to you and for us to have a conversation and make sure that I can direct you to whatever resource you need. I do also do coaching, okay? So I do also do paid coaching, all right? And we have a plan in here. It varies for the individual, but it's called the Disc and Nerve Recovery Accelerator, okay? So if you're curious like what that might be, again, just comment support. I'll reach out and we can figure out what it is exactly that you need. Okay, so I'm getting myself set up here. What I'm going to do is get right to it, which is covering the living disc. All right, and so hey, if you watched any of my trainings recently, you'll see I'll just grab, like, I'll go to different websites and grab different images, so I don't cover up where they came from. I'm not trying to chop anybody's stuff or claim ownership. I also want to say that I'm not vetting these sources. I'm vetting the image for what we're covering. I'm not vetting the source for what they provide. So if you want to go check out any of the resources in here, it's up to you to check out. I'm just trying to provide you good images to go along with the talk. Okay, so the living disc, how discs live and suffer and heal. Off we go. All right, so this first image, it's a spine, okay? Hopefully you can see that. It's a spine, and so the spine is, the backbone. All right, so up here is up above here would be your skull. This is the neck, called the cervical vertebrae. Then here's the thoracic spine, or kind of through your chest and ribs are attached to the thoracic vertebrae, and then lumbar vertebrae. Okay, and so the discs that tend to suffer most are the ones here. Like you can see these bones here, they kind of have little wings on the side. And then between these heavy bodies, this is the vertebral body, between that are the intervertebral discs. And you can see that there's all these discs, and the ones that tend to suffer most are these, actually the lower ones of the lumbar and the lower ones of the cervical. Those are the discs that tend to suffer most. Hey, if you suffer a disc issue, just comment disc. I'm going to give you a chance to participate. All right, get the participation points going. All right, so like I said, if you suffer disc, go ahead and comment disc. And I just want you to see, we got a lot of these discs. Okay, we got a whole lot of these discs, and we're going to get right into some structural things about these discs. These discs are not just like placed there and that's it and that's all. Okay, so here you can see we have a vertebral body, so it's kind of like brownish structure, and you can see little wings off to the side. Okay, those are the off to the side, and then off the back we have spinous processes off to the back. Now between the bodies here, I'll go ahead and scroll this down just a little bit. Between the bodies here, this is the intervertebral disc. Okay, but it's not that this is just balanced on top of this. Okay, there is this anterior longitudinal ligament. Okay, so there's this ligament. If you were like, this is kind of like from the front of the body, so deep. Okay, and this would be from the back of the body over here on the left. So this ligament goes down the front, and look at that broad, flat, thick, strong ligament. Okay, now you can also see that we have these other ligaments. Okay, we have the supraspinous ligament, interspinous ligament. Here, let's scroll this up so you can see these other ones. The set capsular ligament, intertransverse ligament, so that the transverse processes, they have ligaments between them. And then there's a posterior longitudinal ligament. Okay, so there's all these ligaments that support this structure as well. So it's not just hanging there free in space. And I don't think, I actually don't see these images very much at all, where we get to see the ligamental structure of the spine, right? And so, sorry, I didn't show you the ligamentum flavum. Okay, very important. Okay, so we know that we have the vertebra, there's the discs in between, but we also have these ligaments supporting the spine. And then something else that people, you really don't get to see this very much. It's actually kind of tough to get a good image of this. So these are muscles. Okay, so this is the spine, and these are little muscles. Okay, and we have these little rotator muscles. All right, so they go from like one vertebra to the other. Okay, and then we have these other muscles that like they might go from like a rib to the spine, but they might go from the rib of one vertebra or the transverse process of one vertebra up to the next one, or they might skip a couple, or might even skip three. Okay, you can see over here, you can see that these are skipping one, skipping two or three, skipping four. Okay, and so why do these have this arrangement? They're so close to the bones, all right, and they're such tiny muscles. What's their purpose? These muscles actually help to position these vertebral structures. Okay, the vertebra, they help to arrange the vertebra. So you can actually control very minute movements of your vertebra. Mostly these are done subconsciously. And the key to these muscles is that they're done in rhythm with the other muscles, the bigger mover muscles of the body. When those two systems, I'll say these micro muscles and these macro muscles are working together well, you tend to feel good and move well. All right. But I want you to see again. So we have the ligaments, we have these muscles. All right. And why am I showing you guys this stuff? Because I want you to understand that these tissues can heal. Okay. So here it is. Here's the disc between. So we have the vertebral body above and below, and then we got the interspinal disc, intervertebral disc here. And the disc, so this is a side view. From the top, we can see this structure. So if you haven't watched the video about disc structure, comment structure, okay, and I'll get you to that video. Okay, but real quick, so we have this layered structure, the annulus fibrosus, very tough, very durable. And then we have the nucleus pulposus. Okay, so this is more of a gelatin. And so in a sense, you could see this is kind of like a big jelly donut, but with an incredibly durable outer structure. Now I say that, and a lot of you are hurting, and I've actually suffered a lot of disc injuries. If you haven't seen my bio yet and you're curious about my history, can I relate to you? Comment bio, okay, and I'll get you to that. So let's move forward because this gets even more intricate. All right, so this is the vertebral body above and below, and this is the intervertebral disc. Okay, and we can see the nucleus pulposus. This is kind of like chopped in half from the side. All right, and so now you can kind of see some of the layers of the annulus fibrosus here. Okay, the outer part of the disc. And now look at this. There's layers upon layers. Okay, so you can kind of see this. There's crisscrossing structures. And so these things are incredibly durable when they're healthy. Okay, when they're healthy. So how do disc injuries happen? Right? How does this even become a problem? Okay, so I'm going to walk you down how most disc injuries happen, okay, or the prevailing wisdom on how most disc injuries happen. So if you haven't seen the video on disc structure, the training on disc structure, comment structure, because we kind of go through this, but I'm going to give you the quick view. So here we are, vertebral body above, okay, disc in the middle, and then the vertebral body has like an end plate. It's called a subchondral plate, and then a cartilaginous end plate. Okay, and so this kind of softer tissues. Okay, and then those, in a sense, join with the disc, the intervertebral disc. And so we have our nucleus and we have our annulus on the outside. And we can see that this whole thing, so these red things are blood vessels. Okay, so one of the things that we're taught about discs is that they don't have blood supply, right? These tissues don't have blood supply. And so when they get hurt, they don't mend. Well, sorry, guys, there's a blood supply. It's not a big one, but it's there, okay? Now, this inside part doesn't have a direct blood supply, but you can see these arrows. These arrows show how nutrients enter that nucleus pulposus and these inner layers of the annulus fibrosus and the nucleus pulposus. And so let's look over here on the right. And so this talks about, so again, we're talking about the living disc, right? So these blood vessels are what bring nutrients to the disc, and they're also what take the wastes away from the disc. But wait a second, this inner part, there's no blood vessels there. So how does that work? Well, inside your cells, there's no blood vessels either, okay? There's pressures and there are structures that help things move around. But there is some free space. And in that free space, what happens is you have a higher concentration of nutrient density where the blood vessels are making contact, okay? And then you have a lower concentration of nutrient density in the center, okay? And so how does this stuff in the center not just like rot and decay and become a problem? Well, movement, okay? Alternating pressures, alternating compression and decompression. Okay, so it's not just decompression that helps a disc, and it's not just that compression hurts a disc. Discs need both. Okay, so if you're writing things down, discs need both, right? They need compression and decompression because that's how this structure lives. It lives off of movement. It's benefited by movement. Okay, and so when you're sleeping, there's breathing and there's a little bit of movement that goes on, but when you're up and about, okay, the human animal was a very mobile creature for many, many eons. We've only recently become very sedentary. And now, of course, there was always sedentary people all throughout time. I don't think that's the case, but we're a very sedentary culture, especially our culture here in the US, because we have so much money. We have so many resources, and even our poor people are very wealthy compared to people in other parts of the world that have to like get up and move and go find their water and find their food. So the lack of movement can set us up for problems, right? That lack of movement can set us up for problems. So let's look over here. We're going to talk about this a little bit. So what are the problems? Okay, what are the problems that start to happen? Well, so in this image that we have a normal disc here. Okay, so we have the annulus fibrosus around the outside, the nucleus pulposus inside, and over here it says disc degeneration. And so what they're saying here is that this disc isn't healthy. This disc is suffering. Okay, and a disc that's suffering is basically a disc that isn't breathing. Okay, so the circulation that needs to take the waste away and get the good stuff there isn't happening fast enough to care for this disc. And so the structure is beginning to fail. And as the structure begins to fail, a number of things can happen, but we're going to follow the train that's on this image. One of the things that can happen is as this wall now weakens, okay, so let's look. Thick, healthy, incredibly durable wall, okay? Now, look, we're starting to see some thinning. We're starting to see some degeneration of that annulus fibrosus. And now we're starting to see some very serious thinning. And that thinning is now creating a bulge. Okay, now why would it bulge over here? Why would it bulge over here? So if we're talking about forces, the most common observed cause of this is I like to call it the jelly donut phenomenon. I've actually heard it. I actually heard that recently from somebody else. I don't hear it a lot, but it's the concept that pressure on this side, a consistent, unrelieved pressure on this side, is causing this disc to become unhealthy. So it's not getting its alternating compression and decompression. It's just getting mostly compression over here. And now as this wall thins, this quote unquote jelly on the inside, the nucleus pulposus, can start to push through the wall. And it actually starts, these layers over here start to separate and tear. And then over here, we have a herniation. Okay, so in this description of a herniation, they're showing that the nucleus pulposus is actually broken through the wall. So there's a fissure in the wall. And now we actually see this is called an extrusion. So the material has poked out. And then in this image, they're showing it actually pressing on the nerve. But hey, guess what? This stuff, if there's a tear in this wall, this stuff doesn't have to push on the nerve to irritate it. Just there being a tear in this wall can cause this nerve to become irritated. It can cause an inflammatory reaction in these tissues, and it can cause this nerve to become irritated. An irritated nerve is irritable. So downwind, we can have all kinds of things going on. Hey, if you didn't catch the video on nerve structure, go ahead and comment. I asked you to comment structure for disc, so comment nerve structure if you need to get to that video to talk about how nerves are structured. Okay, so this is one way, this living, healthy, vibrant disc that operates off compression, decompression, that's supported by all those ligaments, right? Let me go back. Where's my ligaments? Where's my ligaments? Here's my ligaments. Okay. Nope. What did I do with my ligaments? Sorry, guys. I had my images all figured out in my head, and then somehow I forgot them. Is that oldness? That could be something. Okay, so we have all these ligaments that support this thing, but these ligaments weren't enough to protect that disc. And then these ligaments, we have all these muscles, and all these muscles help to protect that disc, but they weren't enough to protect that disc from this breakdown that we're seeing here. Okay. So let's move on. So let's get a kind of a side view of these things. Okay, so normal intervertebral disc, look at all those, that webbing, that super durable, fantastic structure, tissue, living tissue supported by blood flow and nutrients, and actually innervated. So there's nerves. So a damaged disc itself can hurt. Doesn't tend to hurt like a nerve root, but a damaged disc itself can hurt. So degenerative disc, hey, they're showing all this terrible stuff on the outside of a degenerated disc. My observation, my understanding is that it's more of an inside out process. And if we have a tear here, we're a little bit more than degenerated, okay? But it looks ugly, right? So that's degenerated. So this is bulging disc. Okay, so we kind of see it's bulging on the front, but it has like a pretty nasty little bulge on the back. And right in this little hole here, okay, so your cord runs through here, and then there's nerve roots that branch off, an anterior posterior nerve root that branch off dorsal ventral, and then they join together and they exit through this hole called the foramen. And so now this is starting to intrude on the foramen, and this can actually cause an inflammatory process to happen in this joint here and in this area, and that can all combine to decrease that size, create stenosis and compression of that nerve root. Okay, and again, nerve structure, if you want to know more about that and how that all works. Okay, so herniated disc. So now we're saying the stuff, the inside is poking out. You can see it's taking up even more space. And then when we go down here, we just see a thinning disc. So this is a very unhealthy disc. It's not causing bulges or herniations, but more than likely this thing is going to tear. And then you can have osteophyte formation. Now this is horrific osteophyte formation, and you even have it over here in the facet joint. You can see that osteophyte formation in the facet joint. So this is how discs can suffer, and the pain you suffer could be this disc. It could be from this nerve root as it's coming out the foramen. It could be this facet joint, okay, this irritated, inflamed. So if we like painted this red, right, that would probably be really good here to give us a really good idea of what's going on at that facet joint. So sometimes the pain we feel is kind of off to the side of the disc, off to the side of the where we feel like the spinous processes on our back, can be pain in that facet joint. But referred pain, we can rest assured that there's a nerve that's been irritated. Okay, so how does this happen? Like, how do we have this vibrant, healthy, wonderful thing, and it really starts to crumble and fall apart and become this sort of terrifying image right here? And I've actually worked with people whose L5S1 looks like this, and we've come out of the hole. We've come out of the hole and gotten functional and back to lifting, believe it or not. I've had people who were told absolutely positively no chance, you have to have surgery, but really didn't want to. I don't advise you either way. Okay, your pick. Surgery is your choice, not mine. But if you pick to have the surgery, what you do before the surgery is going to make the biggest difference on what happens after the surgery. What you do before the surgery, okay, what we call surgery prep, is going to have a much bigger impact on your recovery than what you do after the surgery. Okay, so that's rule number one. Rule number two is, if you want to avoid surgery, you got to do stuff before the surgery anyway, right? So you have to do, so it really doesn't matter to me. The thing that makes the most sense to me is do something. Now, what do? I get it. You've all tried tons of different things. Comment support. Let's have a conversation and see if there may be something you missed. Okay. Posture. Okay. So body position, activity and position. This isn't like a finger pointing contest. I did this multiple times. Now standing posture, yeah, I got kind of this sway back, right? That means my butt wants to poke out. My low back wants to arch a little bit. I don't do too much of this forward head action, but I do like sitting. I will see a sitting one of these. Now, some people have the forward head and they have kind of a flat back. Okay, here's what they call, look at this, good posture, poor posture. These labels can make you feel so terrible. The reality is, hey, you've adopted this posture for a reason. You've adopted this posture for a reason. Okay, your body responds. Your brain is reading all of this stuff. Your brain is reading what's going on in your environment, and it starts to make adaptations based on that read. And so this in the middle, I was taught that this, hey, all you got to do is stack everything up and then you just rest right there and it's all nice and relaxed and easy. No, it's not easy. Posture takes work. And if you do smart work, it works way better. Okay, so I have some stuff, for improving upper body posture. Definitely have stuff for improving lower body posture. Easiest way from one place to another is a straight line, but it's never a straight line. But you can have a pretty descript process, a pretty simple and descript process that'll take you from here to here or from here to here pretty well. So, but hey, posture sets you up. So what's the number one killer? Okay, yeah, Sitting posture. People who have driving jobs have a 300% increased risk of having some type of a disc issue. Okay. And so that's because they're sitting. And when we're sitting, it's really hard to adjust posture, right? It's not easy to maintain good posture sitting. We kind of, what happens in the chairs that we use, they kind of like want our butt to swoop under. So this thing over here starts to happen. And then, you know, this forward head can start to happen too, especially like working at a desk. All right. So, hey, if this is you, if you can relate to any of these posture things, comment relate. All right. If you can relate to this posture kind of overwhelming, and it's a natural occurrence. But if we're going to remain healthy and we're going to protect our discs, then we have to do something to bring stuff back the other way. And it's not impossible. Okay. This is by far, far from impossible. But let's go back because I want to talk about what happens then. Okay, so think about it. If I have a slouched posture, that means that this is bowing this way. Okay, so this is looking from the front. Here's the back. If my tail is tucked under, then what's happening is this is bowing this way. Okay, so the inside part of the curve is going to be to the right. The outside, the big long part of the curve is going to be on the left. Okay, look at this ligament. Okay, I call this leaning on the ligament. So what happens when we take a relaxed posture is our muscles start to relax. Okay, so we have these wonderful muscles, okay, that can support us. But when the muscles start to relax, now we start to lean on the ligaments. And if we lean with a little little tweak to the side or a little twist to the side, a little rotation, now we're leaning on other ligaments. Okay, so as the muscles relax, if we're not in a good postural position, we're going to be leaning on the ligaments. Now, if we're sedentary and we're sitting and we're in good posture, we're still not getting that alternating compression decompression. But it's going to be a whole lot better if this pressure is more centered on the disc than if this pressure is now on the front. So again, if we're in this bowed posture where the inside of the curve is to the right, outside of the curve is to the left, the pressure on this disc will be on the front section, and usually it's off to one corner. And then what happens is the disc bulges. It may bulge directly posteriorly, or it may bulge out at an angle. Okay, either way, these things create problems, and sometimes when people go to sit up straight, it hurts more. Okay, it hurts more. If that's you, if you go like, hey, I go to sit up straight and it hurts more, comment hurts. Okay, so if you sit up straight and it hurts more, comment hurts, because that's a real thing that happens to people. And there's a couple of things that are, well, there's a number of things that are tied together with that. One is that the foramen, the little hole on the side where the nerve root comes out, when we extend our spine, which to sit up straight, we have to go from a flexed spine to a more upright spine, which from a flexed position, that's extending the spine. Extending the spine actually narrows that hole. And so if you have a very inflamed nerve or very inflamed tissue around the nerve, that can actually create some compression on the nerve. And so there's actually a step you need before you can work on posture. Okay. If there's also the muscles. Okay. So remember we said we have all these little muscles. If you're not used to using those, they get thin and weak, and they, to hold a good postural position, may overwhelm those muscles pretty quick. And so it may be that you need to use doses, and it may be that you need to use supported postures to help you basically reform this tissue, right? So if we're talking about, we've been in this slouched posture for a while and this disc is bulging, these ligaments have lengthened, like this, we're talking about tissue remodeling. We're talking about helping these tissues to actually remodel themselves into a different, more healthy state. That's not fully comfortable for that to happen. It's not fully comfortable, and it takes time. And so you have, there's ways to go through and create these doses to support these things. So if these ligaments are lengthening, okay, there are actually sensory receptors in these ligaments. There's sensory receptors, and your brain relies on these receptors to help understand where you are in space. There's tons of these receptors everywhere. Okay, so it's not like you're going to like tune into that one. I mean, if you can, that's unreal. But these sensory receptors now, if your brain is sensing that, oh gosh, that support that was there isn't there anymore. Okay, what's it turn to? It's going to turn to these muscles. Okay, and so some of these muscles, so a lot of these muscles tend to shut down. Okay, they tend to go, oh gosh, there's danger, and they kind of pass out. But there are some muscles that tend to go into a protective spasm. I actually didn't pull out those. So really typical muscles that go into a protective spasm would be the muscles on the back of your neck, the muscles on the back of your lumbar spine, but also deep. There's some hip flexor muscles that tend to go into protective spasm. So the psoas, the tensor fascia lata, the TFL. Lots of people have heard about the piriformis. So these muscles tend to go into like a protective tension. A protective spasm is just your brain saying, oh gosh, we need to protect this area. Okay, so if you have tense muscles and you can't get them to stretch out, guess what? There's probably something your brain is reading that's making it think I'm at risk. All right. And so we have to locate that thing. All right. So I said, how do these things, how do we go back the other way? Okay. I'm kind of going long on this. Hopefully you're getting value. If you're getting value, comment value. But hopefully you're gathering, right? So these postural things can set us up for ligament problems. They can set us up for muscle problems. These problems can make the disc vulnerable. And as the disc becomes vulnerable, now the disc can get injured. The living disc becomes an unhealthy disc. Okay. Now here's the beautiful thing. Most of the time, discs recover on their own. Most of the time, people have disc issues and don't have any pain. They don't even know they have a disc issue. Okay. Most of the time, discs will recover on their own. But if yours isn't, it's because something that we talked about isn't working right. And so we have to figure out which one's which, right? Which is it a nerve issue that's preventing you from attaining a proper posture and getting the movement you need? Is it a disc issue? Do we have to do something to help the disc start to recover? Is it a muscle issue? Are your muscles not supporting it? Hey, quick tip here. If you're having pain, your muscles aren't supporting you. Okay, so sometimes people take that logic and say, well, we got to exercise first. Well, it's really hard to get muscles to do what you want if there's an irritated nerve or if there's a disc that's been compromised. It's really hard to get the muscles to do exactly what you want. So we kind of have to keep all of those things in mind, and we have to choose which one makes the most sense to start with in order to work our way out of this little dungeon called disc and nerve pain. If you have questions about that, please reach out. I'm here, folks. Part of my job here is to help direct you to resources that'll be helpful. If you are interested in coaching, I do offer coaching as well. All you got to do is comment support. If you have a question, if you need direction, if you're interested in coaching, it doesn't matter. Just comment support. I'll reach out. We'll have a conversation and I'll try and get you to what you need most. If there's something that we're missing, if you didn't get the disc structure video, comment disc structure. If you want the nerve structure video, comment nerve structure. If there's something else you want to see, you can comment with that. I may have to reach out to clarify, or you can message me directly and I can get you the information that you're looking for. Thank you all so much. I hope you're on your way to a nice, healthy mend and a nice, healthy, vibrant life.